and namaste to all the participants. Warm greetings from Keli Ayurveda family. It's a constituent unit of Keli Academy of Higher Education and Research, Sri B.M. Kankanwadi Ayurveda Mahavidyalaya, Belgaum. Okay, so first I would like to give my salutations to my teachers, because of whom I am able to stand in front of you. Okay, so all the credit should go to them. And one more important thing is today is our Honorable Prime Minister's 75th birthday. So we all should wish him all, happy birthday, and may Lord Dhanvantari bless Modi ji with good health, long life, and strength. Anyhow, he is having. Okay, so today we are going to discuss about a topic where Operation Sindoor will influence a lot, right? So our salutations to our defense forces who fought with such a bravery and protected in protecting our nation. And so there we noticed one thing, like S-400. You all may be knowing about this. The same S-400 is deployed in the Russia-Ukraine war also, where this is not that effective. How effective it was when it came to Operation Sindoor. It doesn't mean that the incoming missiles and all were which are there in Ukraine and Russia war are different, and the ones which were involved in the Operation Sindoor were different. They are the same of almost same quality, but why it reacted differently is what we need to think. It is totally converted. Like S-400 was converted into something called as Sudarshan Chakra, right? So this is what is called as adapt, improvise, and overcome. That is what is very much needed for present day healthcare challenges, because healthcare challenges are day by day they are changing. So if we are not able to adapt to the changes, then we will not be able to overcome. So same thing what happened, we adapted S400, but we improvised it with Akash Tir and Navik. So thereby we overcame all the threats that were coming into the India. So this is based on this only. We need to learn that just by having the knowledge of Ayurveda, the way we are taught or what we have studied is not just enough to practice Ayurveda effectively in present era, because there is a lot of difference. There is a lot of difference in the diseases caused in present day and the diseases that are explained in the text. The name of the disease or the correlation of the diseases that are explained in the text with the contemporary present day diseases may go hand in hand. They may go hand in hand. They may appear same, but something is different. Somewhere they are different from the ones which we study from the Kai Chikitsa line, like what like we can say the base of Ayurveda is Kai Chikitsa only, right? So what we study there, though the diseases may be same, but how they are caused, what is their etiology, what is the pathogenesis, they all are different. So that is why we need to reapproach. So I thought like this may be the right one to discuss. Most often I present mostly on dermatology. So this is also again an opportunity for me to focus or deliberate or discuss about something other than dermatology. Okay, so the topic, like it was a rough title. Okay, it's a good one, like changing healthcare needs as they are changing. So we need to re-examine the Samprapti, how the disease manifestation is taking place, and accordingly the treatment should also change. Right? This is disease burden of India. This is an initiative government of India. The survey was done by ICMR and PHFI, IHME, and this was done for a period of 3 to 5 years, I think. So overall, what the study reported, the main diseases that in present era in India are they come under the category of non-communicable diseases. Like there was a era where infections were high. Now it is changing to non-communicable diseases, and may not be the infectious disease era may not be that far, because we are getting so much dependent on this so-called what you can call westernized hygienic principles, like too much use of disinfectants or too much caring about taking these outside agents to improve our immunity and all. So maybe the era of infections will soon arise. So as per this study, the non-communicable diseases, major diseases they have listed are the cardiovascular diseases, diabetes, chronic respiratory disorders, both allergic and other diseases, mental health issues, neurological disorders, musculoskeletal disorders, cancer, liver, and other kidney diseases, right? That is a government survey. This is one of the survey done by most of the in collaboration with lots of insurance agencies. So they include like tuberculosis, diabetes, cardiovascular disorders, respiratory infections, cancers, HIV, AIDS, vector-borne diseases, liver diseases, malnutrition, and mental health disease. These are the diseases that are said to be more common in present India, right? They are same is true with global incidents also, right? So what some of the studies say, this is one of the study done by World Future Council. So what they said, there are more than 3.5 lakh chemicals and their mixtures that are in circulation in day-to-day life. And every year, hundreds of new chemicals enter our market. And most often, these chemicals are when they are introduced into the market, most of those chemicals safety parameters are overlooked, right? They are overlooked and they gain entry into our environment, the food, soil, and the air, and thereby they enter into our what you can call food chain, right? So this is what happening. Now, recently, one article was published. This is about the food contact chemicals, or they are called as food processing chemicals, food packaging chemicals. As per the estimation, there are more than 4,000, 14,000 food processing or packing chemicals. But seriously, what is very important is the study has shown that more than 3,500, 3,600 plus of these packing chemicals were found in human body. They are found as integral part of our body. More than 3,600 food packing chemicals. They are talking only about the chemicals that are coming into the food chain after maybe like cooking or after harvesting. Leave apart the heavy metals, the pesticides, fertilizers. They enter into our food chain through agriculture, harvesting, and all storage and all. Right? These are not that. These are other than that, which are entering into food cycle and they are gaining entry into our body. And more than 3,600 chemicals were found in human body. Right? Recently, one of the I just forgot to add that one. Recently, one maybe 2-3 months back, Dainik Jagaran, one of the most popular North Indian daily newspaper, published that they did a survey, a study of 122 or 120 plus, okay, 122, 130, 130 within that range. Breastfeeding women's breast milk was assessed, examined, and shockingly, all the samples shown presence of very common pesticides, including DDT and other commonly used pesticides. The pesticides, these chemicals are gaining entry into the breast milk. Recently, I had been to Jamnagar. There, I had a lecture. So I was entering into Jamnagar. There also, I told like I saw so many Jamnagar and Rajkot. Also, I saw so many these IVF centers, ads of IVF centers. And second important thing is, first time I saw a pediatric endocrinologist clinic exclusive for pediatric endocrinology. Something which we were never imagined. We were never imagined when we were in our undergraduation, even during post graduation also. Right? IVF centers. Imagine IVF centers when we were studying at that time. Hardly there were any IVF centers. Right? Now these IVF centers run ads in crores. By spending in crores, they run ads. Why these all are happening? We need to think about that, right? There was an article very recently published. I was just going through that. The title, just understand the title: "The Alarming Rise of Lifestyle Diseases and Their Impact on Public Health: A Comprehensive Overview and Strategies for Overcoming Epidemic." See, lifestyle diseases are considered as epidemic. After reading that, I thought like instead of calling them as epidemic, we should call them as pandemic only. Infections are not becoming epidemic and a pandemic. The lifestyle diseases are becoming pandemic or epidemic in nature. Let us take list of these. Recently, I think previous lecture was on lifestyle disorders. I don't want to go into that, but just epidemic of the diseases like lifestyle diseases like cardiovascular disease, diabetes, obesity, respiratory disease, cancer, liver and kidney disorders, reproductive disorders, mental health conditions. These all are the lifestyle disorders where they are now being considered as epidemic disorders, and we can call them as pandemic also, right? Now, so many things, chemicals are explained, like, more than 350,000 chemicals and all these are categorized into many sections, right? They are categorized into many sections or many categories. One of them, which is very common, as it is not possible to discuss all the things, we'll take one very common and very important. Each and every one should know whether we want to practice it, or whether we want to protect ourselves. At least for that sake, we need to be knowing them. They are the endocrine disrupting chemicals. Right? They are the endocrine disrupting chemicals. What these do, they mimic like a hormone or enzyme. Right? They mimic like the endocrine hormones. They mimic like, they give false negative feedback. They give false positive feedback. They block the receptors. So by this, what happens? They lead to endocrine disruptions. They lead to endocrine disruptions. This data what I am showing now is from WHO website. So what is the reality about these endocrine disrupting chemicals? First of all, from where they come? From where they come? WHO says endocrine disrupting chemicals, EDCs, are omnipresent. They are present everywhere. The toothpaste that we start our day with, and maybe even the bed sheet, the blanket that we use, and even if we put on the mosquito repellent and that all these contain these endocrine disrupting chemicals. Now, what are the things about these? They are everywhere present, right? The endocrine disrupting chemicals are everywhere present. Very low doses is very more than enough. Where we mostly overlook. अरे इतना सा जा रहा है क्या होने वाला है एक दिन जा रहा है क्या होने वाला है right that mentality is there, like very less we are getting exposed, how it's going to harm. But very importantly, these EDCs are not required in large quantity. Very less quantity is enough to cause their target damage, right? And second important thing is they cause delayed manifestations. They cause delayed manifestations. Because of the delayed manifestations, what happens now, whether it is a clinician or the patient, even both think like that. When there is lots of gap between exposure and the outcome. When there is lots of gap between exposure and outcome, the human being, like patient, we all, as well as the doctors, fail to connect them. We fail to connect them, so we overlook. And many times what happens, patients also do not give history of such things because there is no direct link immediate. Like there is a thorn pricked and there is a pain, so we can say that it's because of this thorn. Or yesterday night I had some food and today I'm having some issue, GI upset, so I can try to correlate. Maybe it may be due to the food that I ate yesterday, like that, right? So these, they cause potentially delayed manifestations. And the third point is they cause irreversible damages. They cause irreversible damage, and most often their presentations, their pathologies are overlooked. Overlooked not in the sense that those diseases caused by EDCs are not treated. No, they are treated, but what are overlooked is the EDCs are overlooked. When we are treating a disease caused by EDC, we are not considering EDC at all because they are not causing any new diseases. The EDCs are not causing any new disease. They are causing the same old conventional disease only. They are causing the same conventional disease, right? So what disease they cause? Early menopause, breast cancer, PCOS, PCOD, endometritis, infertility, irregular menstruation cycles. You may be thinking why only female? Because EDCs mostly 70 to 80% they affect, or we can say females suffer 70 to 80% of health issues with EDCs compared to males. Now, recently, my wife was telling she come across with a patient aged something like 31, 32, complaining of menopause. I don't know how many of you, if you are practicing like Sri Roga, Prasuti and all, you too may have come across with such conditions, right? Cancers, breast cancer, increasing, right? PCOD, I will tell you something about PCOD. We will consider that one. Right? Take example of this now present day HPV vaccine for preventing cervical cancer. Why? Because one of the commonest cause for cervical cancer is that HPV virus frequent infections leads to cervical cancer. Now imagine what percent of cervical cancer are caused due to these type of infections. The hair dye that is applied on the scalp or the hair leads to uterine cancer. It can cause cervical cancer. If a lady who is regularly using hair dye, you go and study, not like they are old hair dye, new hair dye, and there is no difference at all. Something which gives color, which is staying for long time. The presently all hair dyes, they contain those chemicals who are very much toxic, highly carcinogenic to the uterus. Right? If a lady is regularly applying hair dye and once or twice, got infected by this uh, HPV, if she develops cancer, CA cervix, how right it is or how correct it is to call that CA cervix is caused mainly because of HPV infections. And if we go in the same direction, even prevention also will become difficult. We need to think in a different way, right? I'll be giving you lots of questions. This is like, something like brain teaser, but then my presentation is going to be like that. See, there is one study. This was done by environmental and reproductive epidemiologist at New York, right? I'm not able to pronounce that. Mount Shine, Sinai, something. Okay, in New York, right? The takeaway message of this study is in the future, it was published in 21, I think, 21, 22. So, in the future, it may not be possible for most of the people to reproduce in an old fashioned way. Now, I told the example of ads about IVF centers. Why IVF centers are increasing? Why IVF centers are increasing? The reason is the chemicals that are entering into our environment, which are coming to our body through our food, lifestyle, the air we breathe, right? The water we drink, the medicines we take, they do all these add to infertility. That is why there is rise in IVF centers, right? PCOD, like example. This is one of the study, uh, Sharma et al. Done in published in it was accepted or published on 28th April 2025 to recent one, most recent one. Because many times what happens now when we are talking about scientific things, at that time people question how old it is. So April 28th, published in a highly reputed journal. This is a survey study of while college going girls in Delhi, NCR, right? The study enrolled 1164 college going females aged between 18 to 25, right? What the study got outcome found that 17.40% prevalence of PCOS in the participants. 17.40%. The global incidence or prevalence rate is 7 to 8%. 8 is the highest prevalence rate global of PCOS. In India, in Delhi, what is the percentage? 17.40%, right? And in that, 73 point were 70.3 were already diagnosed and newly found were around 30%. Now, in your own area, if you are working in a college or if you are in a practicing in a place, whenever a female patient comes, for next 30 days, document the menstruation history, cycle, how it is, whether they are having regular menstruations, is there any history of PCOD, are they showing signs of PCOD? You will get shocking outcome. You will get shocking results, right? This is one more study. Actually, it is a kind of teasing article to Indian healthcare system, but still we need to be referring such things also. So what it says, India is unprepared for PCOS crisis. India is unprepared for PCOS crisis. What this study says, 1 in 5 young Indian women are suffering from PCOS. 1 in 5 means 20%. 20%. So some parts of the, as per this article, some parts of India show 29 to 35% of prevalence of PCOD. Some states or some parts of India show 29 to 35% of prevalence of PCOD. This is what is happening. If we are approaching the PCOD, consider just example. I'm not the subject expert, but as from the Agadatantra, we are the people. I think among Ashtangas, Agadatantra is the only branch which studies Hetu. Visha is Hetu, right? It's not a disease because it's not going to cause any new disease. It's going to cause same diseases which are explaining Kaya Chikitsa. So what is additional we are going to study? We are going to study Visha as Hetu. Means among Ashtangas, Agadatantra is the only branch which studies Hetu. So from the angle of etiology, from the angle of Hetu, I am telling this. So when we are approaching PCOD or PCOS, is it enough to approach with whatever, like, yoni apachikitsa or whatever, is that enough to go and treat PCOD conditions? Or the same line is enough to prevent PCOS incidences? We need to ask. Now about these EDCs only, we'll come to that only. What are the global approaches? What WHO says about this? Strengthening knowledge of EDCs, reducing the exposure, thereby vulnerability to disease. But WHO itself says EDCs are omnipresent. When they are omnipresent, when they are present everywhere, how far we will be able to avoid them? How far we will be able to avoid the exposure? Creating, and again, it is the same thing, like they want to study more further how they are going to cause the disease, what percent of them are going to cause the disease. The focus is on that only, right? Will this approach enough to prevent or treat the diseases or find a solution for the disease caused by PCOD? EDCs? No, because when we are treating only the karya. Karana is the one most neglected thing. Karana is never given importance when it comes to treating the contemporary disease, right? Now, what Ayurveda says about manifestation of a disease, common etiology, common etiopathogenesis or pathogenesis, we can say, pathophysiology, we can say, what Ayurveda says. Acharya Charaka is very, what you can call, very difficult to understand, or Charaka Samhita itself is difficult to understand. This is explained in Prameha Nidana, Sutra Nidana Sthana 4th chapter. What he says, Iha kalu nidana dosha dusya visheshebhyo vikara vigata bhava bhava prativishesha bhavanti. Means, for the manifestation of disease, what is needed? The hetu, and there cooperation with the dosha, and that dushta dosha, disturbing dhatu. Means alignment of dosha, hetu, dosha, and dusha. These three. Right? These are important. But alignment of these three is dependent on what? Vikara vigata, bhava or abhava. What is vikara vigata? Vikara vigata is nothing but immunity. So alignment of hetu, dosha, and dusha is completely dependent on the bhava. Bhava means presence. Abhava means absence. Absence may be disturbance. Strong immunity, vikara vigata, or disturbed or weaker immunity. If it is stronger, there will be no disease manifestation. If it is weaker, then 100% the person is going to suffer from the disease. Right? This is explained in the context of Prameya. But last line, what Acharya say? Iti sarva vikara vigata bhava bhava prativishesha abhinivritti hetur bhavatyuktaha. This is not only for the Prameha. The same is to be understood for each and every disease. Same is to be understood for each and every disease. Means, for each and every disease, what is very important is vikara vigata, which is nothing but immunity, which in Ayurveda we can call Voja or the Bala. So, now understand. Same time, Acharyas have explained Voja Kshaya, Voja Vishramsa, Voja, right? Voja Vyapat and all. Acharyas have explained for that disease also explained, right? Overall, they are going to cause the diseases. But how the Voja Vyapat or Voja Vishramsa or Voja Kshaya is caused, what etiology is said in Kaya Chikitsa approach or in basics of Ayurveda. Is that what actually happening in present day also or something else? Right? We need to think. So when we categorize the present day diseases, we can place them into lifestyle disorders, infections, allergic manifestations, autoimmune disease. Again, they too fall under lifestyle disorders. Again, they too fall under the category of lifestyle disorders. Right? So what is the major hetu for all these? What is the major hetu for all these? Even if we look into lifestyle disorders, First comes the food, next the habits, next is mental health, environment, right? And immunity, they call, right? These are the things common in that tobacco, alcohol, like that. So I consider all them into habits, environment, all the chemicals, right? Now, overall, food is the major hetu, right? Major hetu, right? Ayurveda also, when you look into the diseases, go and study any disease, you will find food as the main hetu, except some diseases like Vatrakta and all, where Ashwarudana and all are explained, very specific to particular disease. Otherwise, when we look into conventional all the diseases, 90%, 80 to 90% of the etiology falls in the category of food. Right? They all fall in the category of food. Let us see what is there in present day food. This is the picture of present day food. The chemicals, the pesticides, fertilizers, ripening agents, preservatives, additives, right? These all. So when we are getting exposed to all these type of poisons, then why we are not getting any immediate manifestations? Because they are not the Sadhyaprana Dashagunatmaka Vishas. They all are low potent poisons, which we call as Dushivisham. Right? Kalantara Prakopi Visham, Dushivisham. Something which goes now and will cause disease after a period of time. Kalantara Prakopi Visham. Delayed manifestations. They are called as Dushivishas. Right? Now, when we look into these, once again coming back to the disease, lifestyle disorders, infections, allergic diseases, autoimmune disease. What is common among these four categories? The commonest thing that is associated with them is, sorry, I went back, is the immune system. Same vikara vigata bhava bhava kriti vishesha bhavanti. Same vikara vigata. So immune system. Like as I told, among Ashtangas, Agadatantra is the branch which looks into the etiology, right? But unfortunately, we are correlated with toxicology, forensic science, and medical jurisprudence of modern parallels. If you go to modern hospital or any teaching hospital also, the poisoning cases or poison related things clinically managed by medicine department. There is no concept of practice of clinical toxicology at all. So I told you, when we are looking at Ojakshaya, Oja Vyapat, Oja Visramsa, we are looking from the classical etiology, right? The same when it comes to immune system, we studied from the same medicine principle, from the same medicine angle. Now the time has changed. We have to change our approach. We need to think about immune system. We need to approach immune system from clinical toxicology, where the disturbance of immunity is explained as immunotoxicity. We need to think about this. So it is an adverse or inappropriate change in the structure or function of immune system after exposure to foreign substance or exogenous substance. What are those exogenous substances? Chemicals, environmental chemicals, again same, pharmaceuticals, biological agents, pesticide, fertilizers and all, preservatives and all, nanoparticles. Right? These all lead to immunotoxicity. Right? So what immunotoxicity leads to? Immunotoxicity leads to immunosuppression, hypersensitivity, and autoimmune disorders. Autoimmunity. Immunosuppression leads to increased infections. Hypersensitivity leads to allergic disorders. Autoimmunity leads to all other lifestyle disorders. All other lifestyle disorders. Now, so the food style, and the lifestyle, present era, the occupation, the environment of the present era, and the mental health of the present era, the present day mental health conditions, they all are causing common diseases. Now, what are involved in this? As a vectors, or we can call, media, the air, water, soil, food, right? And who are affecting? All are affecting. What these such type of diseases are called as? Why it is happening? The ahara, the vihara and vichara is leading to accumulation of low potent poisons in the body, which we call as dushivisha, and that affects oja. The final ultimate target of Visha is Oja only. I think you all have studied in Madatya, like Madhya, how it affects Visha, Chikitsa, you have studied how Dashagunas of Visha affect Dashagunas of Oja. Likewise, Dashagunas of Madhya affecting Dashagunas of Oja, right? They affect Oja. So affecting Oja means affecting immunity. That means when Visha affects immunity, it will not become immune disturbance. It will become immunotoxicity. Immunotoxicity. Again, it causes same diseases which are caused by disturbed immune system. That is immunosuppression, hypersensitivity, and autoimmunity. So what is happening here? The result is same. The outcome is same. But what is happening is different. What is causing is different. Right? So this immunosuppression, hypersensitivity, or autoimmunity, or overall immune toxicity is causing बहुजन साधारणं काल जल देश वात जल देश काल रूपम साधारण रोग कारणम अभिधातुम जनपदोद्वंसनीयो अभिधीयते means what that article said, lifestyle disorders as epidemic, is nothing but janapadodvamsa, because we are getting affected by common diseases, same diseases. Their incidence is increasing. What are the sources? Vata, Jala, Desha, Kala. Kala is what? These lifestyle changes and all. Right? So what should be the treatment approach? What should be the treatment? These are some of the references from other contexts. Like where Kaya Chikitsa line of treatment is done, where normal Kaya Chikitsa line, in normal Kaya Chikitsa line when disease is treated, what acharyas have told. In the same context, when something changes, what acharyas have told us to do. This is the first one is about Shota, right? What it says. Prayo abhigatad anilaha saraktah shotam saragam prakroti tatra visarpanun maruta raktanuchya karyam. You do either visarpa chikitsa, okay, or vatarak chikitsa. If it is caused due to visha, vishaje, vishagnam cha karma. If that shota is caused due to visha, you should do Vishagna Chikitsa. Or what Acharya says us is we should do Vishagna Chikitsa. Where it is explained in a disease which is explained in Kaya Chikitsa. Where almost 99.99% of the Shota, considering Shota as it is the context of Shota, at the time when Charak Samhita was written, was caused by 99% of Shota was caused by conventional etiologies that are explained in the text. Right? And he adds an inclusion. Like for example, due to Visha exposure, if the Shota has caused, then don't go with this Chikitsa, you go with Vishagna Chikitsa. Now think about the present day etiology for the same disease. Now you decide what should be the line of treatment. Jwara Adhikara. Again, Chikitsaya Vishagna Evasa Shamam Labate Naraha. If the Jwara is caused due to Visha exposure, where again Jwara Chikitsa so elaborately explained for different types of Jwara. But when it comes to the Jwara caused due to Visha, what Acharya says? Vishakna eva sachamam labate naraha. Only by Vishakna Chikitsa only the people who are suffering from Vishaja Jwara will get relief. So what should be the line of treatment? Sharira Samskara. I will explain what is Sharira Samskara. So what should be the line of treatment? Application of Dushi Visha Chikitsa. Application of Vishagna Rasayanas based on Viruddhahara treatment principles and application of Garbhastapana. Right? So Viruddhahara Chikitsa is nothing but, Dushi Visha Chikitsa is Shodhana. So that is also done in Kaya Chikitsa line. But what is very important is the Vishagna. How to do this? Like how to select medicines? Whether we have to completely take from Agadatantra? No, nothing like that. Because complete Jwara or complete Shota or complete Kamala is not explained in Jwara Dikara, Visha Chikitsa at all. They are explained in their own context. Right? What is explained in Agadatantra is the Hetu. What is explained in Agadatantra is the Hetu. When Hetu is changing, at that time, we need to change the treatment. Right? So when Hetu is changing, at that time we need to be changing the Hetu specific chikitsa. So when conventional etiology is caused, no problem, go with the conventional line of treatment. But in present era, it's not at all possible to say or diagnose a present day disease as caused by conventional etiologies explained in Ayurveda Shastra. No, they are caused by Visha. So same, for example, when Shota is caused, we have to use Shota. Consider Punarvadikasha. Right? We are giving Punarvadikasha. To that, what we are giving Punarvadikasha? We are giving for the Shota, which is the Karya. For Karya, we need to give Visha. That's it. It's not that difficult. Simple. Treat for Karya what is there in Kaichikis, as per the Kaichikis. Because the same diseases are explained. Even in Agadatantra, not a single Lakshana we find anything which is not explained in Kaichikis. Everything is same as explained. Same Lakshanas are there. Only some terminology may be changed. Right? Damsha Kota. Kota is there, but Damsha Kota. Kota due to bite. Shota is there, Damsha Shota. Shota is due to bite. Visha is Chardi. Chardi is there, but here it is caused due to Visha. Same. Disease is same. Lakshanas are same. What is changing is etiology is changing. So we need to change our approach. To treat for the Karya, that Chardi, that Shota, that Kamala, that Jwara, that whatever it is, the Karya, what we are diagnosing as a name by disease, that is Karya. For that, whatever is explained as per the Kaichikisa, whatever you feel correct, go with that. But what about the Hetu? What about the Hetu? Right? We need to treat for that with the Vishagnata. Okay. Application of Garbhastapana. Why I am telling Garbhastapana? Because we'll come to little discuss detail about Viruddhahara principle. It's one of the important area. Application of Garbhastapana. Now, what is Garbhastapana? संप्रतिस्थितस्य गर्भस्य गर्भोपघातक भाव प्रभाव कंडकत्वेन यत् पुनः स्थिति कारकम. I told you, I'll be giving some brain teasers. Now, what it says, when a garbhopgataka bhava, like considered teratogenic agent or mutagenic agent, a person got exposed to that led to prabhava, that led to bijadushti or DNA damage, whether in the father or mother. Damage has taken place. Kandakatvena, by removing that, by correcting that, punasthiti karakam, which brings back to normalcy, which brings back that DNA normalcy to the normal, which repairs the damaged DNA, is called as garbhastapana. So when it comes to the cancer therapy and all, because one of the disease we saw in the list, cancer, DNA. So what are the present day garbhopgataka bhavas? Teratogenic, mutagenic agents, Vishas. So with garbhastapana, go with Vishagna, or use such garbhastapanas which are simultaneously Vishagna. Right? So I told about Sharira Samskar. We'll discuss a little bit about. Here we need to use the principle of Viruddhahara Chikitsa. Most commonly, the Viruddhahara, when it is discussed, the first line of treatment is elaborately discussed. Shuddhiretreshta Shamova Tadvirodhivi. This is explained, this is discussed. But the second line is mostly neglected. Mostly neglected. What it says? Ravais Taireva Purvam Sharirasya Vishamskritihi. Before the exposure to that particular Viruddha, treat the person with the Aushadha which you wanted to give once the disease is caused due to the exposure of that particular Viruddha. Right? Commentary only, it is very nicely explained, right? Commentary. Clearly it is said. What it says? Yatha Makshika Harityadina, the blue one. Yatha Makshika Harityadina, Pitta Shleshma Harena Aushadena, Santata Shilanat Apisamskrite Dehe, Pitta Shleshmakaram Viruddham, Apyupayuktam, Apyupyuktam. If the person consumes also, Sat, that Pitta Shleshmakara Viruddha, Vikartum Ashaktam, to cause the Vikara, that Viruddha will be not able or will not be Shakta, will not be strong enough to cause any kind of Vikara. Now, applying this in preventing the presented disease. Like for example, we say, what are the causes for presented disorders? Occupation, the food, unavoidable. They are unavoidable. So when they are unavoidable, why can't we work on our body? Why can't we do Sharira Samskar? Why can't we do Sharira Samskar? How it is to be done? I told Vishagna Rasayana. Right? Vishagna Rasayana. Now, Rasayana means, what is Rasayana actually? Rasayana means Labhopayo Shastana Prasadinam Rasayana. So many times the word Labha and Upaya, two things are there. Labha and Upaya. What is Labha? Labha is profit, gain, nutrition, right? Nourishment. Upaya, solution. Whenever there is a problem, finding solution for that is Upaya. Labha and Upaya. Upaya is also part of Rasayana. So in Upaya category, we have to find such Vishagnas which are having Rasayana property. Best example, Dushi Vishara. Why I am telling Dushi Vishara? Because Acharya Sushruta says, Hridayavaranam Nityam Kuryat Mitra Madhyagam. So daily we need to do Hridayavaranam. And in example of medicines, what are to be used? Acharya explains about, give example of Dushi Vishara. Means Acharya is recommending Dushi Vishara for daily use. Means it should have Rasayana property. Then only you can use them daily. There are Gritas, Acharya has explained, right? Ajay Grita, Amruta Grita for Hridyavarna. So that itself is nothing but Sharira Samskara. So in that way, we need to approach for the presented diseases, whether we are going for treatment as a cure or we are going for preventing it, right? We are going for preventing the disease. So when whether we are treating or preventing, we need to go with Vishagna Chikitsa. How usually I practice dermatology only. So how usually I select medicine, how I approach. I select always medicines for Karana and Karya. I told you no, Karya and Karana is very important. Right? Karana, what type of Visha it is. Whether it is low potent chronic poison, so go with Dushi Visha Chikitsa, Dushi Vishagna Ushadi. Karya, what is the outcome? Accordingly. Like dermatology, I am telling if it is Pitta Kapha Pradhana, so I will go with Pitta Kaphara, Kushtagna drugs. But along with that, I will go with Visha, which Visha I am suspecting, whether it is Dushi Visha, right? Whether it is acute poison, any insect bite and all. So we go with Deshangagada or Bilwadhyagada, like that. So what we are doing there, we are selecting medicine for the Hetu and we are selecting medicine for the result. Karana and Karya. That is why it is said, Sri Sutram Shashwatam Punyam Bhubideyam Pitama. Hetu Linga Aushad Jnana. But what we are doing? We are doing Linga and Aushad Jnana only. Hetu, we are neglecting. So when we are treating, Linga means Samprapti, pathology, everything will come. Dosha assessment. And then you are selecting Shamana Aushadhis. Patient is Shaman. Hetu, Vishak. That we need to select. Sometimes there will be diseases where this will become pattern. There will be one karma that leads to one karya. But that karya will not be a disease. Will not be a disease. But that will be an entity to cause number of diseases. For example, we consider low potent poisons that Dushi Visha leads to immunotoxicity. Means immunotoxicity, consider autoimmunity in that, right? But autoimmunity is not a disease. Autoimmunity is again a karana for number of diseases, right? So consider psoriasis as example of autoimmune disorder. So what do? We give Dushi Visha Chikitsa. Medicine we give for Ushagna, Ushagna Dravyas. We give medicine for autoimmunity like Crimigna and all, and we treat for psoriasis. Ushtagna, Crimigna, Ushagna. Right? Ushtagna or Ushagna, Rasayana, and Ushtagna. So you replace the disease, understand. Replace the disease and understand. So based on this principle, you can. I think this is what I wanted to convey. Like why we need to rethink about the pathogenesis and the treatment, right? So to conclude, I think I covered what actually I wanted. For me, it's very difficult to talk about non-dermatological conditions. So I think I have given what is needed for that topic, right? So conclusion is like Taila Dagda, Agni Dagda, Grita Dagda, Doshta Dagda, Prushta Dagda, whatever the source of the Dagda. So what will be the treatment? Agni Dagdavat. So what it says, what is causing is not important. What is in it that is causing. Right? Now Viruddhahara only you take non-fish and milk products said to be best Viruddha which lead to skin disease. Fish and milk. Right? This is if Classical fish, classical milk leads to kushta. Okay, no problem. Kushta due to viruddhahara, right? Present day aquatic animals, consider fish comes with lots of heavy metals. Milk comes with adulterants, and that leads to one kushta or any disease you take. Now, is it okay to call that disease as viruddhahara roga, just viruddhahara, or savisha viruddha? So, if it is savisha viruddha, then the treatment should be different. So, irrespective of our lifestyle, we get exposed to, like, sometimes we may say, like, now we are eating organic food and all. Recently I was talking to one of the person who is working in the direction of organic food and all. So I just asked what is the idea about organic agriculture. No, what he said, we have so far put in so much of chemicals into the soil that to say that we are harvesting organically cultivated products or consider vegetables or anything, we need to leave the land barren, abandoned, at least for 10-15 years, so that those residual chemicals will get washed away. Is it possible? Even though we say we are eating organic food, it's not actually organic at all. Even though organically cultivated, but still not free from the chemicals that enter to our food cycle through the chemicals that we have already dumped into the soil, right? So it's highly impossible to avoid the exposure to the present day so-called low potent poisons. So that is why, irrespective of the disease, I'm not blaming any branch, I'm not discouraging anything. But what I'm saying is, if we want to go with the present diseases, if we want to treat present day disease successfully, irrespective, without second thought, we need to treat for Visha also. I'm not telling only Visha Chikitsa we need to do. No, we have to do Visha Roga Chikitsa, Rogagna, that is for the Karya, but Karna should also be given importance. That is what is the message I wanted to convey. Thank you so much for your patient listening, and thank you, Diksha, for giving me the opportunity to share my views. Thank you so much. Thank you.
Thank you so much, sir. That was really a fantastic session. Now we'll go ahead to the question and answer session. Delegates, please post your questions in the chat box. Sir, there's a question, sir. May I read it out?
Yes, ma'am.
Yes, sir. So explain Vishakta Rasayana in Sharira Sanskara in detail with examples, sir.
Okay. Like I told, to understand this, Shodhananga Shamana, sorry, Shodhananga Snepana. Like for doing Shodhan Chikitsa, what we do Snepana. So that whatever Vata Prakopa is going to happen because of Shodhana Chikitsa, that can be subsided, that can be controlled. Because already we have made our body more snigdha, right? Snigdha Bahula means Akashi Mahabhuta we have controlled in our body, because for the Vata Prakopa, Akashi is needed. So we have very, significantly controlled the Akasha. So even if Vata Prakopa takes place, that will not be strong enough to harm the person. Right? I'll give you an example of disease also. One of our colleague, Dr. Santosh Patil, he did a study based on this principle only, that prevention of complications of radiotherapy and chemotherapy, how it should be done. So we discussed on this principle only, and he selected the topic Jivantadigrita, I think. Jivaniyagrita, Jivantadigrita, Jivaniyagrita, I think. So before the person goes to radiotherapy or chemotherapy, what these radio agents or chemotherapy and all, they are nothing but Tikshna Sukshma Guna Pradhana Chikitsa. Whether they are Dravya Bhuta, Adravya Bhuta, that is secondary. So because radiotherapy means whether it is Dravya or Adravya, again, thing sometimes doubts. So Tikshna Sukshma Chikitsa is going to be done. So when Tikshna Sukshma Chikitsa is done, at that time what will be lost? Vichilata will be lost, Snigdhata will be lost, Sandrata will be lost, Stiratva will be lost. So before we go to that treatment, we need to treat our body. So in that study, what they did, I think, Jivaniyagrita, enema was given, Matra Basti was given before exposure to these chemo or radiotherapy. And the finding is very, very encouraging that the complications of this chemo and radiotherapy were prevented to large extent by doing the Jivaniyagrita Basti, Matra Basti. Okay, this is how we are giving. So Vishagna Rasayana means same when, for example, if a person is working in area where respiratory disease chance is there. Now, what is that dravya which is used in respiratory disorders, but simultaneously Vishagna? For example, Shirisha. Shirisha Vishagna Nam is said. Shirisha is Vishagna, but best for respiratory disease. You go and read Shwasakasa is one of the very important indications of Shirisha. Now, can we use Shirisha as Vishagna Rasayana? Yes, we can use. Right? Dushu Visharagada, I told, we can use. Ajay Grita, I told, we can use. Amrita Grita, I told, we can use. There are so many such things which are in Vishagna, but simultaneously explained to use for longer time. Rasayana means something we can think about. Rasayana drugs means, I told, like Labha and Upaya. Rasayana, when we are thinking, it's not always Labha only. Like they are going to do Brahmana or nutrition and all that type. Not like that. Not nutrition exactly. Upaya is also very important. Means they can be like what is that? Disease specific Rasayanas are explained. Likewise, Vishagna plus acting on particular system, they can be used over a period of time. Then even after exposure, the person will not suffer from the diseases. Clear?
Yes, sir. Thank you so much, sir. Delegates, if you have any more doubts, you can post your questions in the chat box. Delegates, if you have any doubts, you can post your questions in the chat box or you can raise your hand to ask the question directly to the speaker.